So if you're thinking of moving to Cambodia, there's one question that your friends, family, and that one guy in the expat group chat always asks. But what happens if you get sick? Because apparently the moment you mention Cambodia, people imagine you'll get treated by a guy sitting on a plastic chair, using a stethoscope he bought off eBay. And to be fair, healthcare probably isn't the first thing you think of when you think of Cambodia. I mean, temples, yes. Street food? Definitely. And cheap beer? Absolutely. But world-class medical facilities? Maybe not. But I'll say this, the reality is a lot different from what most people imagine. So in this video, I'm going to talk about what healthcare in Cambodia is actually like for expats. The good, the bad, and the surprisingly affordable. And why newcomers spend so many months worrying about it, only to discover that their biggest medical emergency is eating suspicious street food after midnight. So whether you're planning to move here, or retire here, or maybe you're already here and you're wondering if that mosquito bite is normal, this is the video for you. So let's start with the first section. So what happens when you get sick? Because most people imagine a dramatic movie scene when they get sick in a country like Cambodia. But for most expats, getting sick in Cambodia isn't nearly as dramatic as they imagined before moving here. Usually it's not some exotic tropical disease you've picked up while exploring a jungle temple. It's more likely food poisoning, dehydration, a nasty cold, or the realisation that drinking beer doesn't count as staying hydrated in 35-degree heat. And the surprising part is how easy it often is to see a doctor here, because instead of waiting weeks for an appointment, many clinics will see you in the same day, and sometimes within the hour. Plus many doctors speak English, the clinics are modern, and the whole experience is often far less stressful than newcomers expect. In fact, many expats spend months worrying about Cambodia's healthcare system, only to discover their biggest medical emergency is eating suspicious seafood from a night market at 11 PM. So now let's move on to some good news about healthcare here. The good news. Healthcare is often affordable. One of the biggest surprises for expats is that a doctor's visit doesn't require a small bank loan. And if you're coming from somewhere like the United States, you might be mentally preparing yourself for a bill so large it arrives with its own payment plan. But instead, you leave the clinic, pay the bill, and spend the next 10 minutes or so wondering if they've forgotten to charge you for something. And the same goes for many medications, dental treatments, or routine medical care. Because while costs vary depending on where you go, many expats find they can see a doctor, get treated, and pick up medication for less than the price of a messy night out here. It's one of those rare moments in life where getting sick doesn't completely destroy your monthly budget. And of course, nobody wants to spend their vacation or retirement discussing digestive issues with a doctor, but at least it's usually affordable when you do. And now on to the not so good news section of the video. And this is the part that the Cambodian tourist brochures usually leave out. Healthcare quality itself can vary quite a bit, depending on where you go. Some clinics are modern, professional, and well equipped, while others make you wonder if you've accidentally walked into somebody's living room. This is why most long-term expats quickly learn which clinics they trust, and which ones they avoid, just like a suspicious-looking street food skewer. The other thing to remember is that Cambodia isn't Thailand or Singapore when it comes to healthcare infrastructure. For routine illnesses and minor emergencies, you'll probably be absolutely fine. But for more serious conditions, complex surgeries, or specialised treatment, some expats choose to travel abroad. It's not usually a problem, but it is something worth planning for. In other words, it's a good idea to know where the nearest clinic is before you're lying in bed at 3 AM convinced that your mild headache is definitely a rare tropical disease that was only just discovered last week. Now let's talk about the Thailand and Singapore backup plan. Because if you spent any time here around expats in Cambodia, you've probably heard the phrase, if it's serious, I'll just go to Thailand. I mean, it's almost a rite of passage at this point to hear that, because if you even mention a medical issue, then within 30 seconds someone will be sure to recommend you a hospital in Bangkok that they've never actually visited, but somehow trust with their entire life. But the reality is that Cambodia handles most day-to-day healthcare needs perfectly well. But like I mentioned in the previous section, many expats like knowing they have world-class medical hubs just a short flight away. Because for highly specialised treatment, complex surgeries, or serious medical conditions, Thailand and Singapore do provide an extra layer of reassurance. It's one of the hidden advantages of living in Southeast Asia. Your backup plan isn't on the other side of the world, it's often just a couple of hours away, and a lot closer to you than your home country. The funny part is that many newcomers spend years worrying about needing Thailand or Singapore as their backup plan, but they never actually use it. They end up making far more trips for cheap shopping, weekend getaways, and airport layovers than they do for medical treatment. But having the option there gives a lot of expats peace of mind, and that's something worth more than a plane ticket itself. Okay, let's move on to why many expats buy health insurance. Because one thing you'll notice about long-term expats in Cambodia is that many of them have health insurance, even if they rarely visit a doctor themselves. That's because they're not worried about the common cold or a stomach bug. They're more worried about things that nobody plans for, like motorbike accidents, unexpected surgeries, or discovering that gravity still works the exact same way in Cambodia as it does everywhere else. And for routine healthcare, many expats are happy to pay out of pocket because the costs are often manageable. Insurance is really there for the big stuff. If you need the specialised treatment, a lengthy hospital stay, or even medical evacuation to Thailand or Singapore, then the bills can quickly add up. And suddenly that insurance policy you forgot you were paying for becomes the smartest purchase you've made all year. So think of it like this. Health insurance is a bit like a helmet. Most days it's annoying, boring, and feels unnecessary. Then one day you're very, very glad you have it. And if you're the kind of person who says, nothing bad ever happens to me, then Cambodia's roads are filled with people who used to think the exact same thing. So just be smart and get health insurance, even if it is just a cheap one, because it's still going to be better to have something over nothing, worst case. Now let's talk about pharmacies, aka Cambodia's secret weapon. Because another thing expats notice in Cambodia, pharmacies are everywhere here. You need painkillers? There's a pharmacy. You need allergy medicine? There's a pharmacy. You need something for that mysterious stomach issue caused by your late night food market adventure? There's probably a pharmacy within walking distance already waiting for you. And for many newcomers, the experience feels almost suspiciously convenient. In some countries, getting basic medication involves appointments, paperwork, and enough waiting time to recover naturally. In Cambodia, you can often walk into a pharmacy, explain your symptoms, and walk out a few minutes later with exactly what you need. Sometimes you'll even get medical advice, life advice, and restaurant recommendations thrown in for free. And after a few months, every expat develops their favourite pharmacy and treats the staff like trusted healthcare advisors. You'll hear conversations like, don't go to that pharmacy, go to my pharmacy. Then at that point, you've officially gone local. You may not speak Khmer yet, but you've already established a strong relationship with people who sell rehydration salts and mosquito spray, which is a win. On to the next section, which is healthcare outside of the major cities. Because another thing also worth remembering is that healthcare options become a bit more limited once you leave places like Phnom Penh and Siem Reap. Because in major cities you'll find modern clinics, international hospitals, specialists and English-speaking staff. But once you head out to the smaller towns and rural provinces, then your choices start shrinking pretty quickly. Now you might still find local clinics and healthcare centres, but you won't have the same range of services available to you. This isn't usually a problem for day-to-day issues, but it's something long-term expats should keep in mind when choosing where to live. Because living in a quiet countryside village sounds romantic, until you're trying to explain a medical problem to someone while simultaneously figuring out where the nearest hospital is. Many expats love rural Cambodia, but they also like knowing that a larger city is only a few hours away, if they ever need more advanced medical care. And now the final section, the reality that nobody tells you. Because the funny thing about healthcare here in Cambodia, people spend far more time worrying about it before they move here than they do after they arrive. Before moving, you read forum posts, watch YouTube videos, and convince yourself that every mosquito is a flying medical emergency. Then 6 months later, you're living your normal life and barely thinking about healthcare at all. And that's not because Cambodia has the best healthcare system in the world. It doesn't. But most expats quickly learn where the good clinics are, which pharmacies they trust, and what to do if they ever need medical help. Because once you've figured that out, healthcare just becomes another part of daily life, instead of a constant source of anxiety. The reality is most expats never need anything more serious than treatment for a stomach bug, a cold, or a reminder that drinking water is very important. The biggest health challenge often isn't the healthcare system itself, it's surviving your own bad decisions. Whether that's trying questionable street food, forgetting sun cream, or deciding that just one more beer is a perfectly reasonable idea in 35-degree heat. As for final thoughts, what's the bottom line? Cambodia's healthcare system probably isn't as bad as the internet has convinced you it is, and it's probably not as perfect as the guy who's been here 3 months and claims it is either. Like most things in Cambodia, the reality sits somewhere in the middle. There are good clinics, affordable healthcare options, plenty of pharmacies, and a growing number of services aimed at expats. The key is to be prepared, know where the reputable clinics are, get health insurance if it makes sense for your situation, and don't wait until you're sick to figure out your options. Most expats who do a little bit of research beforehand find that healthcare becomes a much smaller concern once they're actually living here. And honestly, after a few months in Cambodia, you'll probably spend less time worrying about healthcare and more time worrying about things like power cuts, mosquitoes, and whether that $1 street food meal was a brilliant bargain or a terrible life decision. And that's when you know you've truly settled in. So to sum this video up, It's good to keep in mind Cambodia may not have the healthcare reputation of Thailand or Singapore, but for everyday medical needs, most expats are surprised by how manageable and affordable it is. The key is knowing where to go before you actually need it, so a little preparation beforehand will go a long way towards your peace of mind. And if you're thinking about moving here, hopefully this video has showed that while Cambodia may not be perfect, it's certainly not the medical wilderness that some people imagine. But that's it for today's video. If you enjoyed, make sure to leave a like, and as always, I'll see you guys in the next video.